Before I get into the monologue today, I want to introduce a couple of new tools. One is Rhino Express. It's the first book I ever wrote. It goes back to 1978, and it was a autobiography of the 2 years that I spent in southern Africa on the White Rhino Conservation Project and the African Elephant Conservation Project, and really a lot of details on how the rhino were caught, where they were sent, how they were sent, and so forth to save the species. Lots of pictures in there. Rhino Express, contact your young duty associate. What a great adventure book to give your kids. And then Prepare. The second one is called Prepare, and the subtitle is The Survival Bible for Patriots. It's kind of a remake of the original God Bless America book with a foreword by a retired Navy SEAL, Marvin Ropp, and really contributes greatly to the survival value of the information in the book. Prepare, the Survival Bible for Patriots. Okay, well, today I want to talk about emotional problems: ADD, ADHD, autism, depression, anxiety attacks, panic attacks, manic depression, and, of course, bipolar. Bipolar is when people are dressed in civilian clothes. When you have bipolar and you're in a military uniform, it's PTSD, same stuff, schizophrenia, and psychosis. Well, the original question here is, how many nutrients does your brain need, your spinal cord need, your central nervous system need? Well, it's 90, 60 minerals, 16 vitamins, 12 essential amino acids, 3 fatty acids. And if any of them are missing or any of them are below the minimum daily requirement, you're going to get these problems. I've seen people with all of them. You can have all of them at the same time if you're really nutritionally deficient. Well, of course, that's why we came up with the Healthy Brain and Heart Pack. And I want you to get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. And, of course, the new DVD, Somebody Needs to Go to Jail, and the new CD, Public Enemy Number 1. And you'll get enough information to really understand what you need to do for somebody's brain. Okay? We have God's Recipe for Kids, which has to do with ADD, ADHD, and autism. We have Women, Athletes, and Kids, which same thing on ADD, ADHD, and autism. There's lots of information out there, CDs, DVDs, books, and so it's not like we don't have information. But you have to get people on a gluten-free diet, no wheat, barley, rye, or oats, so they can absorb the nutrients. That's a big part of it. If you can't absorb the nutrients, it doesn't matter how many you supplement with. That old medical theory, you are what you eat, is absolutely 100% false. You are not what you eat, you are what you absorb. And so kids and adults who have ADD, ADHD, autism, depression, anxiety, panic attacks, manic depression, bipolar disease, PTSD, schizophrenia, psychosis, any combination of those things, one or more, first thing you do is you get them on all 90 essential nutrients. And I like the Healthy Brain and Heart Pack, the D-Stress capsules, capital D like David, dash stress, and, of course, all the dosages are by weight. And I also like to throw in Smart Effects, which is the raw materials for the brain to make neurotransmitters for cognition, which is problem solving, and memory, and also for motor stuff, okay, how your brain and spinal cord directs things to work. And so it's a great program, the Healthy Brain and Heart Pack, the D-Stress capsules, and the Smart Effects. Now, remember, you got to stay away from the bad stuff, the fried foods, the processed meats, oils, includes olive oil, coconut oil, margarine, mayonnaise, salad dressing, cooking oil, and gluten, no wheat, no barley, rye, and oats. And I would also stay away from sugar and alcohol. Sugar and alcohol, alcohol is really just a different form of sugar, and it's fermented sugar, but it still reacts like sugar in the body, including the brain. And so you see people with memory problems, they get hyperactive, they can't function properly in society. And so sugar, including fruit juices, dried fruit, fresh fruit, you can get anything you need from fruit, from vegetables without the sugar danger. And so I kind of like people who have these problems to eat more vegetables and less fruit. Okay, got to stay away from the sugar in all its forms. That includes molasses, honey, corn syrup, agave syrup, all this stuff. People say, oh, good sugar substitutes. Well, they still have the calories and still impact the brain and its functions. Now, one of the things you have to appreciate is that the developing brain in the embryo is sensitive to deficiencies. And so it's not unusual for kids to be born with fetal alcohol syndrome, which is a form of retardation. It's not really from the alcohol. It's from the vitamin mineral deficiencies and omega-3 deficiencies and amino acid deficiencies. Why? Is it so prominent and so devastating? Fetal drug syndrome, same thing. The drugs and the alcohol do not cause the problem. how many alcoholics, how many druggies are going to spend money on their disposable income on vitamins and minerals? Nobody's going to spend it on drugs and alcohol. I'm very, very worried about the birth defect rate in the states like Colorado and Washington because they have legalized recreational marijuana. The marijuana is probably not going to cause birth defects directly, but because these young people, all they heard from their parents who were baby boomers, oh, how wonderful it was to be on pot. Now it's legal. And they're going to spend their money on pot as opposed to vitamins and minerals. When they get pregnant, they're going to have babies with all kinds of birth defects, including ADD, ADHD, autism, depression, manic depression, bipolar disease, anxiety attacks, panic attacks, PTSD, schizophrenia, and psychosis. Every person who shot up a theater or a group of people at church was going to a psychologist and on drugs. Oh, yeah, the side effect is mayhem or suicide. We'll be back with Dead Doctors Don't Lie after these messages.
We've all heard the term baby boomer referring to those born from 1946 to 1964. There are an estimated 80 million baby boomers, with the first wave hitting the Social Security and Medicare systems in recent years, with more to follow. Many healthcare experts are predicting epidemics of Alzheimer's, type 2 diabetes, heart disease, and cancer among this group. However, these impending epidemics can be averted, as there is a new group emerging. This group we call the baby bloomers, because despite their chronological age, they are still physically fit, active, working, and playing. They've heard Dr. Wallach's message regarding diet, lifestyle, and nutritional supplementation. So while many around them diminish in health and vitality, they are blossoming and blooming into vibrant, healthy, on-the-go people. Wouldn't you rather be a longevity baby bloomer? If you'd like to learn more about nutritional supplementation, call your local longevity associate, and don't forget to ask about home-based business opportunities.
Numerous studies have shown the link between the intake of antioxidants and disease prevention. Foods and supplements are measured in an ORAC scale. ORAC is an acronym for Oxygen Radical Absorption Capacity. In other words, the ability to remove disease-causing free radicals from the human body. Longevity's Cell Shield RTQ has an ORAC value of 15,800 points per serving. Cell Shield RTQ contains resveratrol, known as an anti-aging compound, turmeric, known for promoting healthy digestion, brain function, immune system, and cellular longevity. Quercetin, a flavonoid, is known for promoting healthy blood sugar metabolism and healthy lung and cardiovascular function. Remove free radicals from your body with Cell Shield RTQ from Longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
When you perspire, working or playing, your body is losing more than just water. That's why it tastes salty. But what you're sweating out is more than just salt and potassium, as some sports drinks will have you believe. One of the most well-known sports drinks only has 2 nutrients, and it's loaded with sugar. Some have a mineral or 2 with a couple of vitamins. Longevity's exceptional sports drink, Rebound FX, is chock full of cancer-fighting antioxidants, a full spectrum of vitamins, plant-derived minerals, and herbs. Rebound FX is a highly absorbable liquid supplement that gives you quick, sustained energy. Rebound FX supports cardiovascular health, immune health, and boosts stamina and energy. Don't short yourself during and after your workout with just a couple of nutrients. Drink Longevity's Rebound FX for optimal health. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the Pig Pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Longevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Okay, Doug, what pearls of wisdom do you have for us here?
I thought we'd talk a little bit about lower back pain, as I've got a story here that I got from ABC News. Headlined, Steroid Injections for Lower Back Pain Have Limited Benefits, a study says. A epidural corticosteroid injection. It's a common treatment for lower back pain. A review of 38 placebo-controlled studies suggests that therapy may be beneficial only in short term. According to the Mayo Clinic, they say injections are used to relieve pain from radiculopathy and spinal stenosis. It's one of the most common reasons people go to the doctor. According to Dr. Roger Chu, a medicine professor at Oregon Health and Science University, reviewed 30 studies involving the radiculopathy and 8 trials involving spinal stenosis. Observed within weeks of receiving epidural corticosteroid treatment, pain subsided and the function was restored by a fractional amount, but those results were null within about 3 months' time. Researchers included studies that involved transformational transforminal and intralaminar and caudal techniques, or 3-way steroids are administered, as well as various types of placebos, interventions including saline, local anesthetic, or soft tissue. And they go on to say spinal stenosis tends to be more degenerative than a radiculopathy, and it is brought on by the narrowing of the open spaces within the spine. No mention of why that narrowing happens, because those discs are getting depressed because of osteoporosis. They say pressure is put on the spinal cord and the nerves in the spine, causing pain in the arms and legs. Both conditions are characterized by inflammation, a discomfort that can be aided by corticosteroids, anti-inflammatory properties in those. According to Chu, they say, we don't have good evidence on treatments in general, and when that's the case, people kind of turn to what is done, and these therapies have been administered for at least 30 to 40 years or longer. It said his team's findings are significant because previous reviews of the treatment looked at only continuous outcomes and didn't consider placebo types and techniques. The team picked from 38 placebo-controlled studies from a pool of about 50 and analyzed ability of epidural corticosteroid injection to restore function. And they found it was only good for a few weeks. And they go on to say, bottom line, they noted that the findings suggest that spinal practitioners already know that epidural corticosteroid injections are overused. Said there is about 9 million injections administered every year. I think that's the cha-ching factor kicking in there.
Well, you're exactly right, Doug. And, of course, they don't tell you the side effects of these steroids, these cortisones and prednisones. Type 2 diabetes is a common outcome if you use them for more than 3 months. And then also, if you didn't have osteoporosis, you're going to get osteoporosis and fractures. These are serious life-threatening complications of the use of these steroids. And, of course, why would you keep doing that when it doesn't give you permanent results? It really doesn't solve the problem. The problem continues to move ahead, maybe at a slower pace, but it does continue to move ahead. Well, I like to use a nutritional approach. The Healthy Bone and Joint Pack is going to support and promote maintenance, repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. And it's very typical of this approach. And, of course, you got to get rid of all the bad stuff, the inflammatory stuff, fried foods, processed meats, oils, and gluten, and carbonated drinks, including ones you think of as being benign, things like club soda and ginger ale. You get rid of the bad stuff, do all the good stuff, take your healthy bone and joint pack, 1 per 100 pounds of body weight. You're giving the body everything it needs to support regrowth. And you have to appreciate the reason why you get spinal stenosis and radiculopathy and things like ankylosing spondylitis and shrinking and degenerative disc disease because you're nutritionally deficient. Contact your young giving associate and get a hold of the book, Epigenetics, The Death of Genetic Disease Transmission, the DVD, Somebody Needs to Go to Jail, and the CD, Public Enemy #1, and solve your problem. We'll be back after these messages. Okay, Doug, let's go to callers.
All right, let's head to Modesto, California. And Anita, you're on with Dr. Wallach.
Well, Anita, you're on the air.
Hi, Dr. Wallach.
Hi.
I'm calling about a client of mine that is dealing with infertility, and she's been going through IVF treatment, and the last couple times didn't have a lot of luck. She did have one child through the treatment, and but it hasn't been working the last couple of times.
Okay. And did she have to pay $25,000 for each fertility treatment?
Probably at least that, yeah.
Oh, my gosh. Oh, my gosh.
Yeah.
That's awful. These people are taking advantage of her. Okay, what does she weigh?
About, I would guess, 140, 150
Okay.
maybe.
Okay, Charmaine, are you there?
Yes.
Yes. Okay, 140-pound lady, infertile, had one successful pregnancy out of 3 attempts at a fertility clinic. What would you do for her, 140 pounds?
Well, I'd get her on a gluten-free diet, and I'd also get her on I'd get her on the healthy brain and heart pack, and I'd also add the immortalium to it, and clean her diet up and everything. Oh, and then she could get on the Women's FX, too. That probably would help.
Yeah, I put on the Women's FX exactly. Everything you said exactly correctly. 1 healthy brain and heart pack per month. She's kind of on that borderline there, but let's go with 1 healthy brain and heart pack per month. I'd give her a bottle of immortalium so she can have 2 of those tablets twice a day. I'd also give her the Woman's FX. Is that what you said?
Yes. Yep.
I didn't hear you.
Yes, I said Women's FX, yeah.
Yeah. Okay, Woman's FX. And that'll help her with cycles. And so I'd go ahead and give her an ounce twice a day of the Woman's FX. That's 2 bottles a month. I would throw in one thing you didn't mention, and that's that Xerafem, Xerafem. I'd have her take 2 of those tablets twice a day. That's 2 bottles a month. And Xerafem is from the, the Nobel Prize winning biochemistry from 2009, the same time they did the stuff for immortalium, okay? And just great stuff. For the male, for the husband, I'd give him the same thing, except for the woman's effect, obviously. But also throw in the Xera test for him, Xeratest. And, of course, as Shar says, she's got to give up all the bad stuff. That means no fried foods and processed meats, no oils, no gluten. And we'll be back with more Truth, Justice, in the Longevity Way on Dead Doctors Don't Lie after these messages.
Let's head to Oklahoma. And Darlene, you're on with Dr. Wallach.
Hello, Darlene, you're on the air.
Hi, Dr. Wallach. My 73-year-old stepdad on Tuesday the 11th had a hoarse voice. On Saturday the 15th, he went to the hospital. On Sunday the 16th, they determined that he had cancer because he had low platelets. They gave him 2 units of platelets, and it was still low. On Tuesday the 18th, they did a biopsy. And on 20th, this past Thursday, the 20th, they said he had stage 4 small cell cancer, that there was nothing that they can do. It's in the lymph nodes and both lungs. On the 21st, they released him to hospice. And then just today, they said to discontinue all his other medications. and just give him lorazepam, 1 milliliter every 2 hours, and morphine alternate on other 2 hours, 0.25 milliliters to keep him comfortable. His vital signs are good. It's just he's having difficulty swallowing. He can't eat. I was hoping maybe you had some essential oils or something that could help him.
Mm-hmm. Okay. Do they give him a time? Do they say he had 6 months to live, a year to live? And what do they say?
No, they're saying days, maybe 3 weeks at the most.
Okay. All right. I'm going to go ahead and take this one. And what does he weigh?
He weighs about 153.
153, okay. When somebody's in a terminal state like this, good nursing care is going to be the best thing for them. Higher quality of life, and much longer. If they say, I've had people, they said they only have a week to live, and 3 years later they're still alive. And so you just never know. And so that's in God's hands. We do the best we can. But the one correct thing the doctor said was discontinue all medication treatment because there's not much they can do for him. So at 153 pounds, I'd have him take our liquid supplements, very easy. And he can, if he likes ice cream or a shake, he can put it into our Slender Effects, either vanilla or chocolate. Make it with heavy whipping cream or half and half. Throw all the other supplements in there, throw some ice in there, blend it up, make a cold shake. If he prefers ice cream, after you blend it up, freeze it and give him a spoon. Be sure to throw, say, 4 to 6 eggs in there. In each serving, he should have 2 servings a day of that. I do not like them to have Ensure or Boost because they're made from oil, which is trans fatty acids and heterocyclic amines and acrylamides, which actually drive cancer to go faster. And so, let's see here. I would give him our liquid supplements, which would be the ultimate classic. He could have an ounce twice a day of that in that shake. He could also have the Ocean's Gold, which you have to mash up those tablets. I'd have him take 3 at breakfast, 3 at dinner time in that shake. And then he could also have the Z Radical, which is liquid. I'd have him take 3 ounces a day of the Z Radical, 1 ounce of the shake at breakfast, 1 ounce at lunch, and 1 ounce of the shake in dinner time. And again, it's imperative he stays away from all the things that produce free radicals, and no fried foods, no processed meats with nitrates, nitrites, no oils, including olive oil and coconut oil, no gluten, no wheat, barley, and oats. And please call us on a regular basis every couple of weeks. Let us know how your stepdad is doing, and we'll walk you through this. We'll be back with Dead Doctors Don't Lie after these messages.
Let's head to Virginia, and Dillip, you're on with Dr. Wallach.
Hello, Dillip. What can I do for you, sir?
I called you like 2 or 3 months back for my pubic symphysis injury and my neck injury. You told me to take OsteoFX glucogel, 15 glucogel a day, and like the EFAs and the Tangy Kangarin.
Okay.
I'm getting better now. I started running again. I started training again. So I mean, like I'm not completely ill, but it's a lot better. I'm able to run now, and it's improving. And then like I met my doctor, and then I told him I started running, and he was saying like if you run again, you're still going to injure yourself. So I was not sure should I run? And then he was also saying what did I do? How did I get better? I told him about the supplements I was taking. He kind of scared me these things like calcium or any of these mega doses will actually come onto you. So I wanted to check with you to see how long should I be taking this, and so I just wanted to talk with you.
Okay, well, as long as you're exercising, you need to take exactly what you've been taking, stay on the same program. Obviously, you've healed quickly to the surprise of your doctors. And people forget, doctors don't know. People forget, and doctors don't know, that your body needs these non-essential nutrients every minute of every hour of every day of every week of every month of every year for the rest of your life. We cannot get them from our food anymore. In the old days, people would throw their wood ashes from their cooking stove or their heating stove out into the garden. And wood ashes, Dillip, are not really ashes that are 95 to 98% by weight minerals. Unfortunately, all wood ashes are not the same. Some have 3 minerals, some have 18, some have 25, some have 30, some have 40, some have 60. Obviously, the ones that have 60 do better than the ones that have 3. And so it's kind of a throw of dice where you live, how many minerals are going to be in the wood ashes. And so because we use electricity today, you cannot get all the nutrients you need by your food, particularly minerals. Even the USDA, the United States Department of Agriculture, said last year, 2014, that 95% of the people living in America, regardless of your race, your culture, where you're from, gender, age, it doesn't matter. Everybody is 95% deficient in minerals. It's very, very scary. Okay, and you must supplement. There's no other way to deal with this. And because you're exercising, you're going to sweat, and you're going to lose minerals faster through your sweat than people who sit behind a desk in an air-conditioned office and do not exercise. So it's imperative to continue to take this. Otherwise, you wind up with arthritis where you have the injuries in your neck and so forth. And you can reduce your risk of that kind of stuff by supplementing, giving your body everything it needs in optimal amounts every day, every second, and you're going to get a maximum benefit for longevity, maximize the genetic longevity benefit, health benefit, the ability to fend off disease, including arthritis here, which is a common sequelae or a common follow-up problem to people that have fractures of the neck and the spine, or any joint for that matter. And so it's imperative you stay on the program, and you will certainly outlive your doctor. And give us a call every couple of weeks, and we'll go from there. Okay, Doug, let's go to callers.
Let's stay there in Virginia and head over to Rose. You're on with Dr. Wallach.
Hello, Rose, you're on the air.
Yes, thank you, Dr. Wallach. Thank you for your kindness.
Well, thank you.
And how would I say, I'm a person of faith, okay, so for me this is not something I like to be calling for, but because I know you're an MD, and you believe in that, and you're a natural doctor, that's why I prefer to go directly to you. I've been having a weird burning sensation, a vaginal burning sensation when urinating, and I have been noticing the last few days I'm having problems, with the muscles to retain the urine. If I have to go to the restroom, I'm having a challenge in that way. I've been a student of Ben Fuchs, and I'm assuming I know what it is, but I just want to...
Let me ask you a question. Do you have a back problem? Do you have a history of back problems?
I just have been every so often lower back discomfort, but that's it.
Lower back, okay. And have you ever, do you know if you've shrunk in height any since you were 20 years old? Have you shrunk an inch or 2 inches?
I couldn't. Could you repeat that again? I'm sorry.
How have you shrunk in height? Have you gotten shorter since you were 20 years old?
Oh, no. I'm the same height.
Same height, okay.
Yeah.
All right, but you do have a history of low back problems once in a while.
No. I've been noticing that this has been happening just a few days, that if when I go to do this when I go to the restroom, I'm noticing I'm post-menopausal.
Yeah.
I'm in my early 60s. I noticed that.
Yeah. How much do you weigh, Rose?
I'm 93 pounds.
93 pounds?
Yes.
Okay, so you're less than 100 pounds. So how tall are you?
5'2".
Okay, so you're slim. Okay, this is a Shar thing. Shar, here's a lady with vaginal burning, has pain on urination. She has a low back problem. What would you give for her?
I would give her one healthy bone and joint pack.
Okay. And what else would you give her?
For the pain and stuff?
For the inflammation. Give her something oral for the inflammation.
Well, she could take the CM soft gels.
Yeah, the CM Plus capsules, absolutely. And so Rose, Char's exactly right. Char's about your size, about the same size. And so she's been doing this for 25 years. And basically what you want to do, she said, take one healthy brain and heart pack per month and then throw in the glucogel. I'd go ahead and, to begin with, get 2 bottles a month of the glucogel. So you could take 5 at breakfast, 5 at lunch, 5 at dinner. The goal here is to support and promote maintenance, repair of cartilage, ligaments, tendons, connective tissue, discs between the vertebrae. Spread those vertebrae apart, the low back. Get the pressure off the roots of the spinal nerves that control the bladder. Okay? If you've had these chronic problems for a while, you're looking at a back problem, squeezing those nerves. That's why you have pain on urinations, vaginal burning. It's kind of like sciatica of the pelvic organs here. Okay? And the CM Plus capsules, I'd go ahead and get 2 bottles a month. So you could take 3 at breakfast and 3 at dinner time. And they give you a global anti-inflammatory, global pain relief. And you're going to find that this is going to help you as well for some immediate relief here. And then call us every couple of weeks. Let us know how you're doing. And Char gets an A+ here. It's exactly right. And I see this literally thousands of times a year. I've had people who've been given antibiotics by their doctors every day for 25 years. So they said, oh, you have a chronic UTI, urinary tract infection. That's why you have burning on urination. For 25 years, you got to be kidding me. Antibiotics should fix that in 2 weeks. If it was a back problem, of course, the doctor should go to jail. Okay, so give us a call every couple of weeks and bring us up to date. Okay, Doug, let's go to another caller.
All right, let's head to California. And Roger, you're on with Dr. Wallach.
Hello, Roger, you're on the air.
How you doing, Dr. Wallach?
Fine, sir. Thank you.
To get some information for my wife.
Okay.
She has osteoarthritis in her knees and in her back.
Okay.
I'd like to know exactly what she should be taking.
Okay, how much does she weigh?
220 pounds.
220, okay. We'll be right back with you, Roger. Get your pen and paper ready. Char and I will be back, and we will give you a program after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Young Jimmy, Night for Life Crusade. And Doug, let's go right back to California. And Roger, how tall is your wife, Roger?
She's 5'8".
Okay, 5'8". I'd like to see her be 165, so she needs to lose about 60 pounds, 65 pounds. Okay, so Char, here's a lady who needs to lose 65 pounds. She's got osteoarthritis in her knees and her back. What would you do for her?
I'd give her 2 healthy bone and joint packs, and I'd give her the ASAP for the weight loss, and get her on a gluten-free diet and clean up her diet. No burnt animal fat, you know, the drill.
Mm-hmm. Very good. You get an A+. Char's exactly right, Roger. So your wife should have 2 of the healthy bone and joint packs per month, a full dose of everything at breakfast and dinner. That's 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. All that will be accomplished by the 2 healthy bone and joint packs. This is going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself for the osteoarthritis. And for the weight loss, Char is exactly correct. The ASAP, an acronym for as slim as possible, as soon as possible. Have her start out with 1 bottle a month, and it's a dropper bottle of liquid. Have her put a dropper full, not a drop, but a dropper full under her tongue 30 minutes before each meal. Let her have it absorbed through her oral tissue. Don't swallow it. If she swallows it, it won't hurt her, but she won't get maximum benefit. So let her absorb through her oral tissue, and after a couple of days, she'll begin to lose a half a pound to 2 pounds a day. And the magic here is several. Number 1, she stays on the 90 for Life program. She won't gain the weight back. That's because being overweight and obese is due to a lack of nutrition of certain nutrients, as opposed to eating too much and lack of exercise. All right. The next thing that's going to happen is going to help make her weight loss very, very easy. Okay, and she's actually going to again support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, discs between the vertebrae, bone matrix. Now those 2 healthy bone and joint packs, each one has a jar, wide mouth jar of CM cream, which is an analgesic, a pain reliever, and also an anti-inflammatory. And she can apply that to her knees and her back 2-3 times a day. If she's only getting, say, 80-90% relief of pain, she'd like to get 100%, she can add to it the trauma oil, and I'd have her put 6 drops of trauma oil in any heaping teaspoon of the CM cream, mix it up real good with a little toothpick or something like that, so it's evenly distributed, and she will get total pain relief for 3, 4, 5 hours. And of course, you may have to apply it 2-3 times a day. But after about 4 to 6 months, guess what? After you support and promoted maintenance repair, you won't need the painkiller, but I'd keep some around just in case she begins to garden too much. Call us every couple of weeks. We'll walk you through this one, Roger. Okay, Doug, how much time we have?
You got about 60 seconds.
60 seconds. Okay, I'm going to take it and remind people about my book that's out. It was first published in 1978, Rhino Express. It's about my 2 years of adventures in Africa on the White Rhino Conservation Project and the African Elephant Conservation Project. Contact your Youngevity associate and ask for Rhino Express, a great adventure book for your kids. And then, of course, a kind of a redo of the book, God Bless America, called Prepare, the Survival Bible for Patriots. The foreword's by a retired Navy SEAL. We're talking about Marvin Ropp, who's one of our great associates in Youngevity. And you'll just be amazed at the things you can do to prepare for environmental things, fires, earthquakes, floods, what you can do for epidemics to go through, also things like invasions from everything from foreigners, terrorists, what you can do to squelch terrorists in your neighborhood and so on. Get the book, Prepare, the Survival Bible for Patriots. Contact your Youngevity associate and get in on this one. It's going to make the future of your family secure. Okay? And I want to thank Shar for a super job as usual. Thank you, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
Many believe that all life began in the Earth's oceans. We do know that the oceans and seas are still abundant with life and life-sustaining nutrients. Many cultures have long believed in the life-giving properties of plants and sea life harvested from the oceans. Youngevity's Ocean's Gold is a proprietary blend of seaweeds, algae, mosses, kelp, sea cucumbers, and sea minerals, as well as coenzyme Q10, calcium, and iron, all designed to help support healthy thyroid function, regular heartbeat, normal weight, mood stabilization, and hormone levels. Take advantage of life-sustaining nutrients from the Earth's oceans with Youngevity's Ocean's Gold. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
With increasing rates of osteoporosis, it's becoming more and more evident that most Americans have low blood levels of calcium. Some would say,
I get all the calcium I need from dairy products.
Unfortunately, that's just not true. Besides, most dairy products are homogenized and can contain steroids and antibiotics that kill off good bacteria in the digestive system. Not to mention, the human body needs magnesium to make use of dietary calcium. That's why Youngevity developed OsteoFX Plus, containing bioavailable plant-derived forms of vitamin D3, calcium, magnesium, zinc, copper, and glucosamine sulfate. OsteoFX Plus is formulated to support healthy bones and joints. Not to mention, OsteoFX Plus tastes great, unlike other products that taste like chalk or dirt. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity, 95 Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. If you need to lose 10, 25, 50, 75, 100 pounds or more, contact your Youngevity associate and ask for the book Hell's Kitchen. The subtitle is The Cause, Prevention, Cure Obesity. It also discusses type 2 diabetes and the metabolic syndrome. And, of course, we know that type 2 diabetes is caused by deficiency of a single mineral. We know that obesity is actually caused by deficiency of nutrients rather than too much food and lack of exercise. And so ask your Youngevity for the book, Hell's Kitchen. When you get the book from your Youngevity associate, ask for a free copy of the CD by the same title, Hell's Kitchen, and ask about the Healthy Weight Loss Pack and lose a half a pound to 2 pounds a day and never gain the weight back as long as you stay in the 90.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Longevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables. And besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Longevity distributor today. And don't forget to ask about Longevity home-based business opportunities.